Good evening, everybody, and welcome to Conversations with Caregivers. My name is Chris White, again, one of the clinical social workers here with the program, and I'm pleased to introduce our speaker for tonight, Dr. Jennifer Pilcher. Dr. Pilcher was awarded her doctoral degree in gerontology from the University of Massachusetts in 2005. Her professional experience focuses primarily on care and housing arrangements for elders with Alzheimer's disease and related dementias. She also worked in areas including policy and fundraising work for the Alzheimer's Association of Eastern Massachusetts, the Alzheimer's Association of Utah, and the Massachusetts Association of Older Americans. Prior to founding Clear Guidance in 2018, Dr. Pilcher has had a long experience working with people with dementia and their families. She was also for 7 years affiliated with the Hearthstone Alzheimer's Care Assisted Living Program in Massachusetts and New York, where she held a number of positions. Dr. Pilcher also recently served as the president of the board in the New England Association of Aging Life Care and is the editor-in-chief of Journey of Aging Life Care. And so with that out of the way, I give the floor to Jennifer. Welcome and thank you for being with us tonight.
Good evening. Thank you so much, Chris, Judy, Barbara, and all the other staff that may be here. Thank you for your support. I'm going to try sharing my screen and getting this going. And if I can't do it successfully, then Chris is going to help me out. So just give me one moment. Goodness, hold on. All right, can you see my screen?
Yep, we can see it.
All right, let me just make sure. There we go. All right, we're in business. Good evening, everyone. I'm so pleased to be here. When I was asked to return this year, I was really pleased and happy to do that, and I'm glad to be here to answer any of your questions as we go forward. I have a lot to share with you, but I want to reassure you that these slides will be shared after the fact, so don't feel as if you need to scribble furiously like I always do during presentations. I will be sharing both these slides as well as some resources written for you after the presentation. So a lot of people ask me, how did I get into this kind of work? And this woman right here, it has always been my inspiration. This is my grandmother, Caroline, who was diagnosed with young onset Alzheimer's disease in her late 50s. This is a picture of us when I was about 2, not long before we started seeing the symptoms of the illness appear. This is a picture of Caroline shortly before she was diagnosed with her caregiver, my grandfather, David. Their story is 20 years old, more now. Gosh, it was the 1980s. I lose myself in time here. About 30 years old. But the story, some of the themes really remain the same. As they are better now, resources and supports are better than they were back then, but they were very scarce at the time. They fell victim to all the common pitfalls that people often do. They became isolated from family and friends who didn't know how to address her symptoms. They hired a housekeeper to become the caregiver, who ended up taking advantage of my grandfather. My grandfather began to drink too much and not take care of himself while he was caregiving for my grandmother. And as he really did not want to place her in a residential facility, and their home did not accommodate a wheelchair, when she started to have difficulty with ambulation, he carried her from room to room in their house in southern Massachusetts. This is not a story of thoughtful and proactive caregiving. And so I'm here today to talk to you about how we don't fall into those kinds of pitfalls. And the saddest part of this story is that my grandfather predeceased my grandmother, mostly from the stress of caregiving. So we want to talk tonight about how we avoid that kind of outcome going forward. That's not the end of my personal story. Unfortunately, years later, my aunt was also diagnosed in her 50s. This is the two of us shortly after her diagnosis. She passed away earlier this year. And I tell you these stories so that you know this is not just a profession for me. It's not just a professional passion, but it's also something I have lived and breathed as a caregiver and a family member myself. Rosalind Carter said, "It first and best, there are only four kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers." So the message is we're all in this together. I'm going to present you with a lot of information. Sit back and enjoy. Many people ask me, if there's little we can do to change the trajectory of this illness, why plan ahead? Why not just wait and see what happens? This is a list of the reasons why I believe it is very important to plan ahead, and to be aware of what you may need to think about in the future. It is, in my experience, after 27 years of consulting and care management, that these are the things that are preserved by planning ahead. You preserve your choice. You preserve the idea that you are going to get the best care possible. You preserve physical, emotional, and financial health. Hopefully, we avoid family disputes, and you, as the caregiver and the person living with the illness, are able to have more peace of mind. Often for the caregiver, the way forward looks a lot like this picture, a vast landscape with a lot of different paths to choose, but it's really unclear which path to choose or why. Many people expect their neurologist to provide this pathway. The truth is, the role of the neurologist is to help diagnose, identify possible drug trials, decide on helpful medications, and track your progress over time. They are less equipped to help you plan ahead for care. Tonight, I'm going to try to make this landscape a bit less confusing by offering you some keys to success in care planning for people with dementia. Perhaps the most important key to success is to be thoughtful about how the person living with dementia is going to spend their time. Many of the care partners I work with tell me that it is because their person has had to stop working, volunteering, or engaging in activities that they love, they spend most of their time watching television or in isolation. There is an abundance of data that points to isolation leading to depression, anxiety, and worsening symptoms of dementia. So avoiding this is crucial. It's important to point out that in order to avoid some of these negative outcomes, it is important for the activities a person engages in to be meaningful, not enough to just be busy. Many care partners do not know how to create engagement that is meaningful. Offered here are some resources that might be helpful in getting you started. Another part of meaningful interaction is socialization. This can sometimes be difficult to create in the home environment if you don't have a big social network or if that network has shrunk because of the diagnosis. In this case, a day program may be appropriate and helpful. We will discuss more about day programs in a few minutes and how to find one in your local area. It's also possible to hire someone to provide this kind of engagement for the person living with dementia. Which leads me to the next key to success: early introduction of non-familial supports. In my practice, I am constantly hearing from care partners that the person with dementia is stuck to their side like glue. I also hear that the person with dementia will not accept any help from anyone outside of their spouse or adult children. Caregivers report this is so uncharacteristic of the person they knew before, and that it is exhausting. For this reason, it's really important to introduce the idea of spending time with someone outside of the family very early on in the process of the disease. This will allow the person with dementia to develop a relationship with the person providing companionship. It is especially important to do this before personal care like bathing or dressing is needed, as that is an incredibly intimate and personal way of helping that can be quite intimidating to address with a stranger. The earlier you can introduce someone from outside the family, even if it is only for a few hours a week, the better success you will have later on in the process when more support is needed. There are some really challenging symptoms of dementia that are difficult for even the most experienced and patient care partners. If you are dealing with symptoms of dementia that are challenging, learn strategies for addressing them. In our practice, we talk about developing a tool belt for caregivers. This tool belt needs to be filled with tools, or in other words, ideas and strategies for addressing issues and behaviors that are difficult. It doesn't mean that the same tool will work every time, but you have a bunch of them on your belt you can reach for. This means you have options if your first attempt is not successful. Having strategies will help you feel more prepared to address these issues rather than feeling unsure in the moment. Communicating with a person with dementia is not necessarily intuitive. And when I'm working with caregivers in my practice, I often hear them saying, I have to think through this. This isn't my instinct of the way that I would communicate. And this is difficult. I recognize this in working with families every day, but also I had a daughter with anxiety when she was very young. And I remember the psychiatrist saying to me, you need to communicate with her in a way that you're not used to. You need to help her recognize, instead of sympathizing and empathizing with the way she feels, you need to give her the message that there isn't a problem and everything is fine. And I said, but this isn't how I parent. This isn't how I relate to my child. And the psychiatrist said to me, this is something you need to learn in order to help your child. I reflect on that experience a lot when I'm working with caregivers. I understand this doesn't always feel natural, but when you get the hang of it, it can make a huge difference in your relationship with the person with dementia and in your being able to communicate effectively. These are two books that I know of that give a lot of those suggestions about how to communicate and also how to change the environment to address some of the symptoms that you're experiencing. You're not supposed to know how to do this. I say this to a lot of the caregivers I work with. There isn't a prep course on how to take care of your loved one with dementia. That's why you're here. That's why you're reaching out for more resources and information. Thankfully, there are a lot of good resources out there that can help. These are two of those. Both books are available at Amazon as well. If a local library doesn't have them, you should request to have them purchase a copy. Here are some other online resources for learning about these issues as well. And as I said, you will get copies of these slides, so you can go to these links and look at them. There are some YouTube videos and in-person and online education programs for caregivers. It's a good sign you're already here. That means you're already reaching out and already have a connection to a good resource for education. But here are some others for you to look into. Evaluating risk is another key to success in planning ahead. As a care partner, it is important that you're constantly doing risk assessment. This means assessing any behavior or change in the person with dementia that could potentially put their safety at risk. In being a partner to someone with dementia, we know that it is impossible to eliminate all risk. There is a certain amount of risk that is acceptable, and it is up to you how much risk you are willing to assume to a point. At Clear Guidance, we talk about the line between risky and behavior that is risky and behavior that is dangerous. The key is to identify something, an activity or a behavior, when it is risky, so you can address it before it becomes something that is truly dangerous. This can be very difficult to do as a care partner as you are so close to the situation. I like to talk about needing to get the balcony view, which means rising above the situation and looking down on it objectively in order to evaluate what could be risky. I encourage you to find someone at the Dementia Collaborative or the Alzheimer's Association or both that can help you discuss and evaluate these issues and help you work through the issue of risk. In order to be proactive rather than simply reactive to these issues, we need to be on the lookout for what I call the red flags. Red flags are warning signs that something is changing that may affect safety. I've listed for you here on the screen the red flags that most often come up with clients that we are serving at Clear Guidance. And so I want to just make you aware of these. So one of them is when the person with dementia seems to be aware of their safety, but then there's a change in their awareness of what they need to do to keep themselves safe. When you see changes in things like mood, sleeping behavior, sleeping pattern, their behavior, their engagement in relationships, when you see increased agitation or irritation, anxiety or stress, more or increased resistance, and then things that have to do with your physical safety. When you start seeing issues with vision or visuospatial issues like depth perception, when you see the person having difficulty negotiating stairs or changes in flooring throughout the house or in another building or outside, changes in gait or balance, a loss of interest, and then also, what are you seeing in yourself? Is your stress level going up? And are you seeing changes in the way that you're coping? These are all red flags we need to pay attention to that indicate to us something is coming and we need to address it before it becomes a real dangerous safety issue. There are two other issues, and I added these two slides this year because I thought it was really worth addressing. There are two areas around risk that are really important for older adults. So if you are caring for an older adult, meaning over age 65, there are two risks that are associated with being older and with having dementia that really are a threat to older adults. And those are falling and medication errors. The CDC predicts that by 2030, 2030, there will be 7 deaths every hour in people over the age of 65. That's a shocking statistic. And we know that falling results in head injury, it results in injury, and yes, it can result in less ambulation, infection, and even death in some extreme circumstances. So avoiding falls is a really important thing to do. And you have a resource for this that you may not be aware of as a caregiver. When you see things like gait or balance or issues with visuospatial reasoning, you should call your primary care physician and ask them to order the visiting nurse service for a physical therapy evaluation. You can use this service over and over, even if you've used it before, when you see a new issue. A physical therapist can come out, can talk to you about what you need to do with the environment in your home, what exercises you need to be doing to maintain strength and balance, and how you can avoid falls going forward. So utilize this. It's that simple as calling your primary care and asking for an order. The second piece is medication errors. And when I talk about medication errors, often people think about an error you might make yourself, taking the wrong medication or in dosing it or helping somebody else take their medication. Actually, that's only one part of medication errors. It's bigger than that. This is a study that was done that looked at where medication errors occur and how often they occur. The scary part is that the error can happen anywhere between the time you're sitting in the doctor's office and they tell you, I'm going to prescribe this at this dose. I want you to take it like this, all the way there from the time it arrives in your home and you are dispensing the medication. Unfortunately, there are transcription errors. Often, people over the age of 65 have more than one provider that is prescribing, and often those people aren't necessarily on the same page. Even in the era of electronic medical record, you need to go to every doctor's appointment with a list of the medications you believe you are taking or the person with dementia is taking, and make sure that all providers know what other providers are prescribing. This is supposed to be caught by the pharmacist in the pharmacy. They're supposed to look at what you're taking and flag any kind of interactive effects that you might have between medications. But pharmacists make errors too. And computers don't always flag things they're supposed to flag. It's really important that you keep a journal of what you were told by your doctor, you're being prescribed, the dose, the frequency, all of that. And if at any point it doesn't look like it lines up with what your doctor told you initially, loop back to your doctor and ask. Ask the pharmacist when you are picking up the medication, have you checked that there are no bad interactive effects of the medications that I'm taking? Ask that question and continue to ask questions as much as you can, so that we can avoid these errors and these risks. Okay, another key to success that care partners don't often know how to address is their health insurance. Likely at some point along the journey, the person living with dementia will need care in a rehabilitation facility or a long-term care facility. It's important to know that some health insurance products will limit where you can get this care. Most people aren't aware that having a Medicare Advantage plan or having a supplemental plan such as Tufts can limit where you can receive care. We have a massive shortage of rehab beds in the state. That's a long story and it's a whole presentation on itself. But we have had bed reductions. We've had facilities that have closed. We have facilities that don't have enough staffing. And for that reason, you don't want to further limit where you could potentially get care when you need it. You want to make sure you have the most flexible insurance plan that will not limit these options. I have given you two resources here. The first one is free, which is a Shine counselor, which is at every aging access point in the country. And I've given you a link where you can go and look at what is the aging access point where I live. And then I've also given you a woman named Lori Howell, who is a private Medicare advisor who can advise you both if you are looking to get onto Medicare and haven't done that yet and trying to figure out what your supplement should be, but also if you are in a Medicare Advantage plan, what should you change to? How should you manage that? And she can walk you through that. So I would try the free resource first because you might get everything you need there. But if you don't and you have a complicated situation, that's a person you can reach out to as well for consultation. A key to success you probably already had some advice about is legal and financial planning. Most neurologists are good at advising their patients to make sure they have up-to-date estate planning documents, such as a will, power of attorney, and healthcare proxy. This is good advice, but to be truly proactive, you need to understand and appreciate why this is important. The first reason it is important is because at some point, you as the care partner will probably be in a position where you need to make decisions for your partner living with dementia. When this will happen for you is impossible to predict, but I want to talk about how and when this can happen. A person who is able to make their own decisions about their health knows the questions to ask of their health care provider, understands and accepts the possible consequences of the diagnosis, and can incorporate new information into a decision about treatment. Some people with dementia can maintain the ability to make decisions like this very late into the disease. For others, this will be something that is more difficult within a short period of time. Many people ask me why it is so important to have these documents in place early on. It's really two reasons. One, after a certain amount of time has passed, a person with dementia may no longer be competent to sign these documents, particularly a will and a power of attorney. So it is really important that you get these documents done early on. Secondly, if a person living with dementia has not identified ahead of time who their decision maker will be, and they are determined incompetent, their family or other parties will have to file for guardianship for health decisions and or conservatorship to manage their finances. The person to serve as guardian and or conservator will be assigned by the court and may or may not be a person the person living with dementia would have chosen. Therefore, in order to maintain the most choice and control over who makes your decisions, it's vitally important to have these documents in place. There's one other document that I want to talk to you about today that is a lesser known but equally important document to have. Many estate planners will talk to you about signing what's called a HIPAA release form. And if they don't bring this to your attention, you should bring it to theirs. And here's why. A healthcare proxy document is just a document unless or until the person with dementia cannot make their own decisions. And then it is what's called activated by a healthcare provider. Before that, it really doesn't give you any power to access information, to have information, or make decisions. So a lot of estate planning attorneys now are suggesting you also sign a HIPAA release form for your care partner that gives you immediate access to information about health It helps the provider, the neurologist, the primary care, whoever else you have involved in your life. It gives them permission to share information with you, whether or not your healthcare proxy has been activated. So this can avoid a lot of stress and strain down the road. It can allow caregivers and partners to have access to protected health information at any time in any circumstance. And it also can allow providers to share information with each other. I do recommend having an estate planner help you draw this up, but I did put the link on this slide to the free form that is available in the state of Massachusetts, which is better than nothing, that you can download from the internet and fill out and have as part of the documents that you have along with your will and your healthcare proxy and your power of attorney. In addition to having these formal documents that talk a lot about, what you would like done in the future, particularly with your finances and that kind of thing, it's really important for the person who is assigned as the decision maker, which is most often the care partner, but not always, to be aware of the person living with dementia's preferences for care. It's really important that whenever possible, the wishes of the person living with dementia are honored. These conversations can be difficult to have, especially after a diagnosis of dementia. There are two free and fantastic websites that are helpful in having these discussions. One is called Honoring Choices of Massachusetts. They also have them in other states if you're beyond Massachusetts, but it's a good place to start. And a website called The Five Wishes. Many resources for how to have these conversations as well, I'm sure can be accessed through the Dementia Collaborative. So you can ask for those as well. But what I like about both of these websites is it gives you questions that you can ask. It helps you with the conversation. And it helps you to think about what are the areas you would really like to know about in the future when you may have to make decisions for that person on their behalf. Along with legal documents, it's important for you to plan ahead about the cost of care in the future. Most people are surprised to find out that typical health insurance does not cover care. There are a lot of different places for you to go to look into this that are really important. If you are over age 60, you may be eligible for programs that can offer assistance with paying for home care and or assisted living. I want to be clear, this pays in part for home care and assisted living. It very rarely covers the entire cost, but it can help. So there is something called the Frail Elder Waiver. There are other programs like PACE that you may be eligible for and should look into. And I've given you links here to information about both of those programs. If you're younger than 60, you may be able to apply for disability through Medicare. Maybe your neurologist has spoken to you about that. Maybe they haven't. I've given you the link here where you can go and apply for disability. If you're not eligible for programs offered by the state right now, is there a way for you to qualify in the future? This is a good question. If you're going to pay privately, how long will the money last? And will you need to apply for Mass Health long-term care benefits in the future? These are the questions you need to ask of an elder law attorney. If you don't have one already, I've given the link here to Mass NALA, which is the organization, the trade organization that elder law and estate attorneys join in the state of Massachusetts. So you can click on that and find someone in your area that can help you. I'm going to give you a brief overview of what the costs of care look like. regardless of how you will fund care, it's important to learn ahead of time what the options are, when they're appropriate, and what the potential cost may be. So I've laid this out for you here on the screen. I also have a handout that Judy's going to be sending you that has all of this on it. So we're just going to briefly go through it, and you're going to be able to find this information in other places. There's companion care, which is really for supervision and companionship. There's home health aid care, which is really when we need hands-on assistance with personal care as well as medication reminders, things like that. Both a home health aide and a companion can do things like housekeeping, light housekeeping, food preparation, errands, transportation, and other kinds of household help. But the difference is really when you need someone who can help with personal care. There are different ways to hire a home health aide or a companion. You can do that on an hourly basis where you're paying per hour. You can also consider the option of having a live-in person who can come and live in your home. That is less expensive than having someone awake there overnight. But some people can't accommodate a live-in, or it's really a foreign idea to them. You can also have people come 24 hours a day if needed, and you pay them by hour as well. That is the most expensive way to provide care at home, but in some cases it is needed. I've given you a link here on the bottom of this slide as well to the Home Care Alliance of Massachusetts, which will give you a way to search for agencies in your local area. If you're outside of Massachusetts, you can also use the Community Resource Finder at the Alzheimer's Association, or look for the Home Care Alliance in your state. Also, you can utilize the folks at the Dementia Collaborative who can help you find an agency in your area as well. Or you can speak to a person like me, a consultant, aging life care professional, and I will tell you later about that, who can also direct you to agencies they've had experience with and might be able to give you advice about. There is also the option of a day program. I've given you sort of the average cost per day of a day program now. A lot of people really benefit from these programs. And I'm happy to say that a lot of these programs have come back after the pandemic. Many of them had closed their doors. But not only are we seeing them come back, but we're actually seeing new programs opening, which is really wonderful. And I would encourage you to think about this in relationship to the discussion we talked about at the beginning of the presentation about socialization and meaningful activity. This is one of those places where that can take place. One of the challenges some people have is with transportation to day program. So you should ask a lot of questions about whether or not that specific program offers transportation, and what are the options. Again, you can use the Community Resource Finder to find the local day programs that are in your area. To plan ahead, you need to get familiar with the types of residential options that are available should you need them. This slide really is sort of a visual representation of the level of care that exists out there for you and what it can look like. And so it's meant to look like stairs to show you that these, as you go up the stairs, that increases the amount of support that can be given in that residential setting. So we start at the bottom with independent living, or elderly housing is another place that people live often when they don't need a lot of support. The next level up is assisted living. Also, we have people living in group homes, rest homes, or in congregate housing. So these are situations where you do have your own apartment and you do get maintenance and housekeeping and all of that, but you also can have periodic personal care. You can have some assistance with joining activities. You can have medication reminders. And so often this works for people with mild memory loss, um, and people without memory loss. So that's something to think about. A special care unit, sometimes it's called a memory care unit, sometimes it's called a special care unit. These units exist both in the assisted living setting and in the skilled nursing setting. And so the difference really is how much assistance do you need? And do you have other medical issues that would mean you would need to live in skilled nursing? Skilled nursing is the highest level of care that exists, and is often a last resort. On the bottom, you will see that there is an arrow, and under it, it says CCRC. The CCRC stands for Continuing Care Retirement Community. And these are places that have all of these levels of care on one campus. This is possible. Entering a CCRC, you often need to be without a diagnosis, or there are some that will allow couples, if one is caring for the other, to enter into independent living. But it's not a resource that we use as much in our practice when someone has already had a diagnosis, because there is some screening and some questions they might ask you ahead of time. As well, CCRCs are usually buy-in, where you have to put down a significant chunk of money to buy into the community. So it's often not the best solution for our clients, but it is out there. And so something you should ask about when you are looking at the different options. A question I get a lot is, well, how the heck do I know what level of care is needed? And who can tell me if I don't know? So again, I would direct you to your local aging access point. They can help you. If you are in a hospital situation, you can talk to the discharge planner or the case manager that you're working with, who may be able to give you a sense of what level of care you need to be at. For those of you who are still working, you might have employee assistance programs that could give you some assistance with this. It's also true that when you go and you visit a facility, and then they will want to do their own assessment of the person living with dementia, or of the both of you if you're going to move there together. And so they will give you their feedback about what they think is the appropriate level of care in their community for the person living with dementia. And then also, if you want to know before, if you don't have any of those other resources and you want to know before you start looking, often a aging life care manager like myself can come out and do an assessment for you and talk to you about the level of care. I am sure the experienced social workers over at the Dementia Collaborative can also be helpful with this. So they are also resources to you. Again, I've given you a chart here about the, to give you some help with the idea of when are different levels of care needed. I have given you a chart here that lays out the average cost and when these different levels of care are appropriate. And again, you'll be getting this chart in more detail after the presentation. It would take a long time for me to review these individually, but I want you to know that you have this information, the average cost, what it looks like, what they provide in general in these different levels of care. And I have also given you on the bottom. So this slide, there are two slides here. This slide just looks at assisted living, and special care or memory care in assisted living. And on the bottom, I have given you some links here to places that talk about what do you need to be looking for when you're looking at assisted living? What are the aspects of the building you should be looking for? And if you're looking for special care or memory care, what should you be looking for in that case? The next slide talks about nursing and rehabilitation, which is short-term care, and then also long-term care in a skilled nursing environment. Just a couple of things I want to point out here. Assisted living in general, private pay exclusively. There are some programs that can supplement, that can help with the cost of assisted living if you are eligible. And that's a good question to ask the folks at the Dementia Collaborative, and they can give you the names of the programs and you can look into that. But in general, private pay. A short-term rehab stay in a skilled nursing facility is usually covered by Medicare or by your health insurance. Long-term care in a skilled nursing facility is the only type of care that is covered entirely by Medicaid or Mass Health, as we call it here in Massachusetts. You can pay privately, but if you run out of funds or you don't have funds, this is the place where you will be taken care of, and Mass Health will cover that cost. Again, I've given you some links about what you want to be looking for when you're looking for this kind of care, and more information about what this kind of care might look like. The one thing I want to warn you about is please do not rely on Google for choosing a facility. And I had to throw in the Encyclopedia Britannica for those of us who aren't as familiar with Google. The point is that information that is shared by other people may or may not be accurate. So, and Google reviews are classic for either being way rosier or way more negative than they should be. And so it's really important for you to do your homework. If you are looking at assisted living, I have given you two search engines that exist on the internet, New Lifestyles and the Massachusetts Assisted Living Association, also their search, which will help you search not only what are the places in your area, but also do they accept some of these programs we've been talking about that you might be eligible for to defray some of the cost, and also the features, the services, and the amenities that they have. And so those are the places to go for that. On the top left, I've given you the link for looking at skilled nursing facilities. This is only one tool that's out there, but it's an important one. Every skilled nursing facility is given an evaluation periodically by the state, and the state writes up the results of that survey. So if you go here to this link and you put in the town or the name of the facility or both, it will pull up a list, what's in your town, what are in the towns around you, and it will show you how they were rated by the state. It's not a full picture, but it is one tool. I encourage you to also look for people that have placed their loved ones in facilities to ask them questions. And I would also strongly suggest you talk to an aging life care manager who has clients in those buildings or has had clients in those buildings. I know there are a lot of places out there right now, like a place for mom, and these are not bad places to go if you're looking for information. It's free to you. But I do want you to be mindful that there is an inherent bias, which is that these placement agencies get commissions from the communities that they refer to. If you move in, that's how they get paid. It makes sense. An aging life care manager doesn't get paid that way. You pay them, so they are more objective in this area. So I encourage you to reach out to someone like that to get information about what's in your area. But in terms of recommending quality and whether it's the right fit for your family member, rely more on the other resources that you have around you at this point. Many of our clients come to us because they are having a hard time deciding. Should they try to care for someone at home, or should they be looking at a community? And, you know, is it one? Is it the other? Is it a combination of the two? What's the timing? When should I start thinking about this? And what are the trade-offs? One thing I want to say about this in general, which I say to every one of the families we work with, there is no perfect timing. There is no golden rule. This is based on your situation and what makes sense for your family. There are a lot of different things to take into consideration. It's not ever too early and it's never too late. So I want to reassure you there. There are reasons to think about doing it earlier than later. And again, I encourage you to reach out to the social workers at the Dementia Collaborative, talk to the Alzheimer's Association. These are people that know about what are the reasons we would go more quickly into a community rather than caring at home. Caring at home can be really challenging and really expensive. And so there are times where we need to look at other options, even if it's not our first choice. But for many families, it's a combination. They're going to work at home for a certain amount of time, and then they're probably going to opt for a community setting at some point. This is a really good place. If you are going to reach out for help, this is a good place to reach out for help to talk through this issue, as it is a really hard decision to make as a caregiver. The biggest advice I can give you is don't go it alone. Gather a team of experts that can help you. If your home were a business, you would not want your organization chart to look like this, right? You're not supposed to be playing every role. As a caregiver, think about what are the things you can only do and what are the things you can outsource. Think about the resources you have, the friends you have. How can they help you? Approach them and offer them an idea. Many friends and family are waiting in the wings to be told what they can do to help. You need to tell them and make it specific. They will thank you for giving them something to do. And that will take the burden off of you. I cannot underscore the importance of self-care as a care partner, as I know many of us on this call would echo. Having a team of people who can advise you is important because the data on caregiver health and stress is not good. As you can see from this example, in this study, 17% of care partners reported that their health was either fair or poor. This is 7 percentage points higher than the general population average. More importantly, 38% of caregivers reported feeling highly stressed due to caregiving responsibilities. Equally shocking are the number of caregivers that predecease the person with dementia, in large part because of the stress of caregiving, like my grandfather. This is very important. Join a support group. Find ways to decrease your stress. And if you're not sure what those are, reach out and ask. There are many of us that would like to help you with this burden of caregiving. If I didn't make the point strongly enough, here's a few other facts and figures for you from the Alzheimer's Association. This is a serious issue. Care partners are near and dear to my heart. It's who I work with every day. And I think taking on the role of caring for someone with dementia is an important and significant role for you to play. We have to take care of you as well as we take care of the person experiencing the disease. Oops. Okay. At Clear Guidance, we believe that if you are brave enough to live with dementia, or if you are a partner to someone who is living with dementia, you are a superhero. But no superhero can do it alone. You need a team of sidekicks. Myself, the folks at the Dementia Collaborative, the Alzheimer's Association, we are here and trained to be those sidekicks for you and to support you and your family along the path of facing a dementia or cognitive impairment diagnosis. Lean on us, and I welcome your questions above and beyond what I have presented here this evening. Should I stop sharing, Judy, and then we can take questions? Okay. Are there questions in the chat already? Maybe I should address first.
Yeah, there's a couple. I will reiterate to everybody here on the call that if you have a question for Dr. Pilcher, please write it in the chat and I will read them in the order that I see them. So, but we do have a couple here already. The first one comes from Janet and Dave, and they ask, are you aware of any resources or programs that are designed to address the unique needs of individuals diagnosed with young onset Alzheimer's or young onset dementia?
Yeah. This is an age-old question, and my answer is this: not enough. There are not enough resources or programs that are designed and addressed to meet the unique needs of people like this. It's one of the reasons I have a job, frankly, is because a lot of the time what we are doing with young onset is we are taking the resources and programs that we have available for older adults and trying to make them fit for younger adults. And there aren't a lot. There are a couple of online resources or resources where you can get information about young onset and how it's different. But in terms of like local resources, there are some home care agencies that have good training and experience with this. It's a question you need to ask when you're looking for in-home providers and you're caring for someone with young onset. Have they cared for someone with young onset before? I will tell you that one of the issues we run into a lot in young onset is sometimes it's much harder for the caregiver, the formal caregiver, not you as the care partner, but the caregiver coming from a home health agency. It can be emotionally taxing in a different way. We need to make sure those people have the support and the training so that when they experience that, they're able to manage that going forward. So I think that's a question you want to ask. There are some assisted living and skilled nursing facilities that have a bigger population of people, younger people that are experiencing this. And so you want to ask when you're touring, do you take care of younger people? And do you have, younger people living with you now? Have you experienced this in the past? And I would even want to ask the provider, do you know the difference? Do you know what it's like, how it's different to take care of someone who has young onset as opposed to later onset? This is something I'm working on professionally. in really pushing for specific programs to address the needs of these younger onset people. I will say the Alzheimer's Association has support groups for people living with younger onset and for care partners of people living with younger onset that can be really good resources to you. And so I know they have some that are virtual and some that are in person, but I would go on the Alzheimer's Association website and look specifically for those groups. I used to help run them, so I know they exist, and I think they're an important resource. I wish I had a better answer for that question.
Right. Well, I think we in the business know that it's still an area that is in great need, especially for, counseling and support group resources.
Yep.
Um, all right, going on to the second question. And again, reminder that if anybody has any questions that they'd like to bring up or to ask Dr. Pilcher, please write it in the chat. This next one's a bit of a long one. So I will try to get through it as best I can. So this comes from Jim. And Jim writes, going back to being the caregiver um, or caregiver with other support, I found my wife began to lose her recognition of me as her husband. Setting aside the difficulty during that time, I found that after my wife went into a memory care facility and I was able to regularly visit her, she began to recognize me as her husband. I initially thought this was a pleasantly unique situation. In time, I learned of other men who had similar situations while at a men's support group. I don't know if this is a similar experience for wives caring for men. The question is whether there is any research on this type of occurrence. Some aides report seeing a similar situation, but only with men. It would be interesting to research and to be a positive influence on caregivers who are going to make the gut-wrenching decision about going into a memory care unit.
Mm. So that's a very poignant point, Jim. I have heard of this before. I don't know that there is a lot of research in this area. But what I will tell you is when we're working with care partners who are considering this move, you know, one of the things we talk about is what are the benefits of living in a structured environment? And one of the benefits we often point to is that the environment is purposefully simplified, right? And structured, that there is a routine that happens throughout the day that is the same. The activity might not be the same, but the structure of the day is the same. And one of the things that we often find, whether it's recognizing, being clearer, having more focus, or recognizing your spouse, or whether it's having less anxiety, less agitation, all of that, we often see those positive things happen when people move into a structured environment that isn't as chaotic or demanding as the home environment is. So there's a lot coming and going when you're living at home that can be really overwhelming for a person living with dementia. And if you can simplify that and get into a routine that the person can adjust to, often they can spend more energy focusing in other areas. And so that to me is the explanation of what went on there. And I have seen it with both men and women, Jim. So I don't think it's exclusive to men, but if it is, if that would be an interesting research project for sure to look at, the positive influences of becoming part of a residential environment and how that affects the person with dementia. So I also think there's a lot of research on isolation and lack of socialization and meaningful activity being a real problem that increases anxiety, depression, confusion, disorientation. So it could be that there are many things about the environment that are helping your wife to function better in the world and helping her brain to make that connection of recognition of you. And isn't that wonderful? I'm really happy for you.
I would
So,
also say that at least this has been somewhat the case in my experience is that for caregivers, especially ones that are, doing a lot, day in, day out to support, a person with dementia at home, there is a sort of blending of roles, right?
Right.
And what tends to kind of get lost in that equation is the original sort of nature of the relationship as a partner,
Right.
specifically. So, as difficult as it might be, one of the sort of silver linings that I often see when working with families is that, the transition to an assisted living or a transition to a memory care unit where, the partners are unfortunately separated, there can be an opportunity to sort of refocus on the relationship because now you have other individuals, other professionals performing the caregiving duties that that person was doing before.
Mhm.
So, you as the caregiver don't have to worry about that, and you can focus solely on, the positive experiences and spending time and being, and re-engaging as the partner rather than as a caregiver. So,
Yeah,
um,
that's absolutely right, Chris. You're right. And I think also there was some other comment in the chat about that too. You get to be the husband when you turn over the caregiving duties to somebody else. And so maybe the refocus on your relationship rather than the business of caring, um, was part of that. I also see that Beth added Lorenzo's house to the chat. Yes, great resource. They're doing a lot of work, particularly with children of people with younger onset dementia, and a lot of programming, and they do provide some support. It's a national resource. They're not going to know your local programs or resources, but yes, a wonderful program that's newer to us for sure.
all right. So moving on then, some other questions have come up. Susan asks, you mentioned some new day programs opening. Could you tell us about them? And as a second part to that, do all memory care units offer the same level of personal care, or is this something that we need to ask specific questions about?
Question. Great question. So I'll deal with the first one and then we'll go to the second one. Some of the newer programs that I know of are Elderwell in Natick is one of the newer programs I'm aware of. And then Active Day, it has been opening several sites, mostly on the South Shore, like below Dedham and South. But those are the two newer programs that I'm aware of that I can come up with off the top of my head without looking at my database. And I think Active Day has a plan to expand further into other geographies. So that's something to look at. I know we have clients who've had some positive experiences there, so that's always a good thing to be seeing on the horizon. There are many more that closed that were actually really good. So I'm really happy to see the emergence of more of these programs. I think they're so important. The issue of memory care units offering the same level of personal care. This is a really, really important question, and I could probably do a whole presentation. I have done whole presentations on what are the questions you need to ask when you're looking for placement. But this is particularly important. Often, I'll just give you an example. Often incontinence is something that varies how incontinence is managed, what is there an additional cost for that? Um, that is a really important question to ask, and often where there's discrepancy between programs. So yes, they are not all the same. What they will do is different. There are some memory care units that will utilize things like Hoyer lifts or sit to stand lifts or will allow for two-person transfers. There are others that won't do that at all. So if you get to that point where you're non-ambulatory, they may say, this isn't a place we can care for you. So I think that is a really important question to ask. The question I like to ask is, what are the reasons a person would need to leave this program? And what are the things I might get charged for that are not part of the base fee for service. One of the difficulties in looking at memory care programs is that some of them are, it's an all-inclusive fee. You pay one fee and that's for everything. For others, I call it the a la carte menu, right? You pay for this and then you're level 1, 2, 3, 4, 5, and families can get really disrupted by moving in thinking they're at one level of care, and then the community comes back and says, in fact, we're going to bump you up 2 levels because you need more help than we thought you did. So those are difficult issues to work through, and it makes it hard to compare apples to apples when you're looking at memory care. So you really need to ask all those detailed questions about what will they provide for personal care? What are the reasons someone would have to leave the program? And then what are the additional things that you could get charged for that would add to your expense? So I think those are all really, really good questions.
This often comes up in our work as well. I would also say some additional questions to think about asking if during the research process for a memory care unit or any sort of, transitional setting where a person's going from their home to a place, like an assisted living or memory care or skilled nursing facility. Things to consider are asking about employee retention, like how long do employees tend to stick around in the role that they are. A lot of facilities, they might have high turnover rates, meaning that there are a lot of different people coming and going, which can be fairly disruptive in implementing care because it takes a whole set of time to get to know the person, get to know the ins and outs. Um, so having a high retention rate is a positive sign. That means the place is dedicated to, retaining their employees, keeping the good ones around. And like I said, it's not a guarantee, but it is a positive sign. The other aspects, worth asking about, if you're talking with one of these facilities is, what is the ratio from staff to consumer? More important, I would say, on a memory care unit, but basically what it means is like how many staff are responsible for how many consumers at any given time. You want as low a ratio as possible because that means more individual, care and attention to, your loved one if they happen to be on that unit or in that, that part of the facility. So, um,
Yeah, one thing I would add to that, Chris, is ask who is included in the ratio that they're reporting.
mhm,
Because the ratio that you want is direct caregivers to residents. You do not want the nurse, the activities person, the executive director included in that ratio. And
right,
sometimes I find that when you get a report of a ratio from a community, when you dig in a little more, they're actually including those people in the ratio, and that's not fair. That's
right.
not the way you should be looking at it. Yeah.
Yeah, it is a bit misleading, but you definitely want the direct care ratio.
Right. And one other thing, I mean, like I said, Chris and I could do a whole presentation on just this issue of what do you ask when you're going into a placement. But one other question on the issue of staffing that I think is important. Right now, we know everybody is having difficulty staffing. We have a crisis in home health care staffing. It is in home health, it is in assisted living, it is in skilled nursing, it is across the board. One of the things that these places need to do in order to address that is to use what they call temp staff, temporary staff that is actually employed by another agency outside of the community. And so one of the questions you want to ask is, are you using temporary staff, and how often do you use temporary staff? Families that I've worked with have been really surprised over the last couple of years when they see a new face on the floor working with their loved one, and they inquire. And not only do they find out it's a new face, it isn't someone who's been retained, right, as a long-term employee, but they don't even work for the facility that you are living in. They work for another agency and they're only there temporarily. So that's an important question too. Do you use it, and how often do you find yourself needing to use it? I think that's another indicator of quality.
Absolutely. All right, so we have about 10-ish minutes left, so try to get to as many as we can here. Emily asks, is it possible to retain the services of a resource like Clear Guidance earlier in the process and have them/you available over time at different points when more help is needed? In my case, the disease has been very slow and progressing. I am trying to be proactive, but we are 9 years in. I would like to line up resources for future peace of mind.
So the answer is absolutely yes. This is one of the things that I do a lot with clients, and I'm always happy when people come to us before there's a crisis and we can do some planning. Um, at Clear Guidance, we do offer very flexible consulting. You can come in and out of our practice at any time. And we have families that utilize us for a few hours up front. We make a plan together, and then we may not hear from them for another 6 months or a year, depending on what's going on. That's totally acceptable. Um, in the packet of information that you're going to get after this from Judy, there is I put in there the search engine for people like me. It's called the Aging Life Care Association. It's our trade association. You can go in there and you can put in your zip code and you can find someone that's in your local area. Um, of course, I would love you to call me, but there are lots of other people out there that are doing a similar thing and can be available to you in a consulting way. So yes, absolutely. That is not only is it possible, it's a great idea. So the more you can address these things, proactively, as this presentation is all about, the better off you'll be, no matter where you are in the process. Okay.
Great. All right, so with about 5 minutes left, I'll try to get through one or two more questions. Diane asks, for a patient who has apathy and denial, any suggestions for how to get him in to see the neurologist? PET scan 2014,
Lack of
with
glucose.
lack, yeah, it's been slow progressing, but now short-term memory is prominent, plus some continual behavioral issues.
Uh-huh. So this is a tough issue, and something that we often deal with at Clear Guidance is guiding families around how do you get someone who is resistant to being evaluated to the neurologist. And I actually have a whole presentation for other professionals about how to talk to clients that they think might need an evaluation and why it's important. Sometimes we talk about the fact, and this is absolutely true, that there are other things that could be causing your symptoms. And so going to a doctor or a neurologist is really important to rule out anything organic or metabolic, something treatable that could be causing your symptoms. That works well with someone who is really in denial or not recognizing the issues. Sometimes you can work with the PCP around making a referral to the neurologist, and then it's not you saying they need to go to the neurologist, but it's a professional saying they need to go to the neurologist. Another way we talk about this sometimes is it's just important as you age to take care of every organ in your body, including your brain. And so, this is just par for the course that your PCP would recommend that you go to see a neurologist. So those are some of the ways that we have these conversations. I think the one thing that does not work is when someone really is lacking insight into their symptoms. What does not work is to remind them of the symptoms they're experiencing. And because of those symptoms, then it's important for them to see a neurologist. If they really lack insight about the symptoms they're experiencing, then using that sort of rational approach to get there is not going to be helpful. And so, those are two of the strategies that we use occasionally. There are lots of others, and I'm sure Chris and Barbara could be helpful also in talking through those strategies as well. I'm sure that comes to you guys as much as it comes to me. So
Oh,
it's
absolutely.
yeah, but there are a lot of ways to do that.
Yeah. The one thing I will just say, just in the interest of time, but just very quickly, um, the word choice of denial, I would just be very careful about making the assumption that what we're seeing with a person when when they might be saying like, I have no memory problems, my memory is fine, there's nothing wrong. It may not necessarily be that there's active denial, although absolutely it still could be the case. But bear in mind that when we're talking about diseases like Alzheimer's or, anything on the dementia spectrum, we're inherently talking about a brain disease. So it's something that where, the brain governs everything that we do, including knowing when something is off or miss or, just not working correctly in our bodies, right? So it could theoretically not necessarily be that the person is in denial, but more that because of the underlying issue, which again needs to be evaluated and, to determine what exactly is going on, you know. But it may not necessarily be that they're in active denial. It could be that due to the underlying cause, that lack of insight is prominent. It's not necessarily them being difficult. It's just part of the disease. So,
Right. It actually has a name. Anosognosia is the name of it. It's a symptom that many, many, many people have with cognitive impairment, not just dementia, but other illnesses as well. And it is important to acknowledge that it's not active denial. It's really a lack of awareness of A, the symptoms that you're experiencing, and B, how they're impacting your life. That's really where I find the insight comes. You might acknowledge, yeah, well, my memory isn't great, but you might not really understand how that lack of memory affects your daily life, affects your functioning, and impacts other people around you. And that's really where the insight is, right?
yep.
All right.
All
Um,
right. So we're just about on time. There were some questions regarding resources in New Hampshire and resources for respite.
okay.
Um, I would say the resources in New Hampshire, one option would be to contact with the Alzheimer's Association. Their care consultation service is also present in New Hampshire.
Yep.
And I know they're great about connecting folks up there, so that's one option. For respite, Jen, do you have any specific resources for respite care?
So there are both skilled nursing facilities and assisted living facilities who will provide respite, but who's doing it and when is a mystery. So what you need to do is if you have a location that you like, and you need to call them and ask them if they offer respite care. Most of them do, but if they're full with a wait list, they may not have a respite bed available. And so you just need to call and ask. Some of them have requirements for how long they won't do. I'll tell you right now, they won't do 3, 4 days. It's at least a week, probably 2 weeks. And part of that is because it's hard for people to transition with cognitive impairment. And so, doing that shorter stint can be really hard on the person with dementia. So I think respite is one of those things you have to call and find out if they are providing it at this current time. And do they have a respite room that they anticipate will be available in the future, or do you have to call when you're getting ready to go away to find out what's available? Unfortunately, it's just one of these moving targets. Um, and then, of course, you can always call a home care agency for respite as well, who could come to your home and take care of your loved one if you needed to travel or take some time off.
Mhm. Real quick on that, Janet and Dave say that many local senior centers will provide a few hours of respite care per week. They became aware that in their town they had an active center. They had a center for active living, and once a week for 3 to 4 hours, you can drop off your loved one to give yourself some respite.
Yeah.
Longer respite is another process, but that's something that is available depending on where you live and what location you happen to be covered by. So. But unfortunately, with that, because we're having such a great conversation, we are at time. So I just wanted to wrap up very quickly by saying, Jennifer, thank you so much for presenting to us today. It was a wonderful presentation. I hope everybody here learned something and got something positive out of tonight's discussion. So thank you again for coming in and chatting with us.
Thank you for having me. Nice to see everybody.
All right. So from the Dementia Care Collaborative, I hope that everybody has a wonderful night, and we hope to see everybody here next month.